Bismillahirrahmanirrahim. My dear fellows and students and colleagues, and those students who are appearing in the undergraduate examination or postgraduate examination or any examination, whether it belongs to the country or outside the country. Now I am Professor Sayyid Ali Haidar, visiting professor of Janasir Medical University, Karachi, and I am taking a serial of lectures on infectiology, that is the infection and the disease. Before going forth with, but I have actually discussed about the fever, the pathogenesis and the paroxysm of unknown origin, the prolonged fevers and acute fevers, and the paroxysm of unknown origin, undifferentiated fevers. And now I want to discuss something about the fever with the rash first of all. A fever associated with the rash. And I'm taking, because it's a long discussion. So I have split it into two parts, session 1 and session 2. Now remember these golden sentence. Every microbe which can enter into the body can cause bacteremia, whether it is transient or actual bacteremia, frank bacteremia, or viremia, or fungemia, or hemoparasitemia, or rickettsemia, or sporocytemia, etc., etc. Can cause fever with the rash, fever and rash. Now some are specific rashes, but mostly they are non-specific. They do not indicate, except the bacteremia or viremia. It is a transient phenomena. Some rashes, they are sine qua non of the disease, and they are specific rashes, very specific rather. They are the hard data of the disease. For example, the coptic spots in the measles, said to be the sine qua non of the measles. But anyway, the coptic spots are also seen in the same group of viruses. It's possibility, but in most of the cases, the coptic spots are the sine qua non of the measles, if you want to look. Now fever, temporary, it is increment of the body temperature. It is the body temperature in response to some disease or illness, you know that. It is associated with the rash, which is the temporary eruption of the skin. It will come for a few days, or rather, if you prolong a week, and it will definitely resolve afterwards. Discrete red spots, generalized reddening may be there, or other type of skin involvement. It may mostly in part accompanied by itching, and in some part it is accompanied by the pain in the around the rash, Lewis response. So history should be thoroughly taken. That is the contacts with at the home, in the daycare units, traveling history of the pets inside the home, insects related, or meditations and medications and drugs, immunization history, and features of the rash should be described. What type of rash it is? Temporal association, one onset related to the fever, temporal association. Whether the rash comes first, and then the fever comes first, and then the rash. The progression and evolution, stages of the rash, where it is located, which part of the body is located, where it is started, and the distribution associated with the pain or pruritus, are not associated with any pain or any pruritus. Now this type of history should be taken when the fever occurs with the rash. And most of the rashes associated with the fever are of the pediatric origin, children, because most of the diseases which are causing the rashes are under the age of 10 years or 8 years. Most of them, not all. Physical examination, its distribution pattern. I've said the symmetrical eruption, asymmetrical rashes, its morphology, it is monomorphic, of the same type of rash, or is pleomorphic, or polymorphic. It means the rashes are of different structures or morphological characteristics. Now configuration, you see it is a linear rash or annular rash, or it is what is called plaque type of a thing, or grouped together in a one part of the body, for example around the knee. But Koebner phenomena is actually a reactive phenomena, and that is the eruption in the area of the local trauma. You see in cases of psoriasis, for example, the Koebner phenomena, but it will also, you will observe this phenomena in other type of rashes associated with the autoimmune diseases. So Koebner phenomena can be demonstrated. This is some of the terminologies should be repeated. The macule, these are the rashes we cannot palpate it. It is not coming out of the dermis. Absolutely flat. It is equal to the lining of the skin. You see this rash. It may be of any color, reddish, purple, or whatever it is. The area between the two, you see these are normal. It is seen on there, the neck area, here is the nose, this is the area you see here, in this part of the body, where it is started and involving the other part of the body. The pattern of distribution, that is, the pupil, it is the raised part. Same is now raised, you can palpate it. So pupil, it is a pupil, means that it is raised from the dermis, you can palpate it. Vesicle is the same pupil which is containing the fluid. It is out of the dermis lining, and it consists of the fluid, clear fluid inside. It may be associated with the papillovesicular, means pupil was there and then is converted into vesicle. Both are seen. Then we pursue, now the same vesicle is infected, and then the pus is very clearly seen inside it, and in many parts of the body. You see this type of the pustular type of rashes, very, very symmetrical in distribution, in, for example, in varicella, that is chicken pox. And then a bullous type of a rash, bullous eruptions. You see in cases of the pemphigus or pemphigoid, that is the autoimmune dermatological manifestation, bullous eruptions may be seen as a drug reaction. It may be a part of the Stevens-Johnson syndrome or erythema multiforme, the bullous type of eruptions. Linear type of rashes, very linear. You see in cases of the urticaria, for example. You see the annular type of rash. This is the, see this very clear margin here. Inside slightly paler, and the margins are, it is a margin which can be palpated easily, and these type of rashes are usually associated with the fungi infections. That is, in cases of the tinnias, you will find these type of rashes. The Kubner phenomena means that at one time the patient was actually he is in remitted stage of the psoriasis. If you traumatized with your nail or some sterile object touches the skin, then this phenomenon occurs like this. It will provoke this. It is also seen in the Bath's disease. It is also seen in other diseases. In differential diagnosis of fever with a rash, this is a maculopapular rash. Macule is red, pink, discrete flat areas, blanched under pressure. Or it may be papular, solid, raised above the skin and the spherical lesions. Tiny blanching on pressure, not full blanching on pressure. Pathogens or infection, probably viral type of diseases are there in children of the skin, and the viruses are measles, rubella, and roseola, acne rosea, or other roseola infantum, etc., erythema infectiosum, fifth disease that is called, and Epstein-Barr virus, infectious mononucleosis, Arcovirus, hepatitis B virus, immunodeficiency virus, and the bacteria are seen, like erythema marginatum and scarlet fever, forgotten fever. I will take a class separately on this subject because it is missed by the physician. Erysipelas are also missed by the physicians. And syphilis, leptospirosis, Lyme disease, rickettsias like Rocky Mountain spotted fevers, typhus fevers, and other fevers related with the rickettsias. And the autoimmune diseases like rheumatoid arthritis, Kawasaki disease, and drug reactions is a very common problem. The patient related the eruptions with the drug, new drug introduction, and the lesions are seen as maculopapular type of rashes. You see the diffuse erythroderma, the diffuse one. And here you see like this. Thickened scaly skin on the palm of the skull, there are thick skin. And the bacteria are involved in this case, like scarlet fever and the toxic shock syndromes, staphylococcal toxic shock syndrome or streptococcal toxic shock syndrome. Fungi like the Candida albicans and the diseases related with the autoimmune diseases like Kawasaki syndrome or vasculitic syndromes is possible with these type of the diffuse erythroderma, urticarial type of rashes, hives, type of things. And these are spots of reddish hair, swelling of the lesions appear in and resolve rapidly. They may be a part of the transient type of infections. It may be due to the what is known as the hereditary type of the angioedemas, urticaria. Viruses, Epstein-Barr virus, hepatitis B virus, HIV, bacteria like mycoplasma pneumoniae can cause this urticaria, or group A streptococci, and the others like, for example, drug reactions to urticaria are very common. It can cause fever also. The vesicular pustular bullous, all lesions in one. Vesicular raised hemispherical lesions less than 0.5 centimeter contain clear to pustular or bullous raised hemispherical lesion more than 0.5 centimeter and contain the clear purulent fluid. But it may be clear in bullous, but it may be pustular in pustules. Like the viruses have herpes zoster virus, shingles, varicella zoster virus, herpes simplex virus, that is, and Coxsackie viruses and bacteria like staphylococcal toxic shock syndromes and staphylococcal bullous impetigo, streptococcal clustered impetigo, others like toxic epidermal necrolysis, or I said erythema multiforme, Stevens-Johnson syndrome, rickettsial pox. You see these type of lesions in the different parts of the body. And petechial type of purpuric rashes, small pinhead hemorrhagic type of lesions, that is purpuric lesions, petechial lesions, non-blanching red purple spots. Viruses like atypical measles can cause, or the measles cause the macular rashes. But in this type, the particular purpuric rashes can occur in atypical measles, congenital rubella, cytomegalovirus, enteroviruses, HIV, and herpes viruses, etc., etc. Bacteria, sepsis, like meningococcus, coccemia, gonococcal infection, pneumococcal, and hepatitis B virus, and it can also be seen in the cases of the other hemorrhagic type of the fevers. Rickettsia, Rocky Mountain spotted fever, for example, fungi like Aspergillus, mucormycosis, and autoimmune diseases like vasculitis, thrombocytopenias, henoxal and purpura, malaria, petechial type of rashes. Erythema nodosum. Now, it is a tender, remember this is tender, red nodules due to the exudation of the blood and the serum. So, erythema nodosum etiology is multifold. It is not a specific lesion, although viruses like Epstein-Barr virus, hepatitis B virus, and bacteria like group A Streptococcus, it may be a primary tuberculosis, Yersinia pestis, cat scratch disease. It is associated with the erythema nodosum. Fungi like Coccidia, deep mycosis, that is Histoplasmosis capsulatum, and others important here is sarcoidosis. And inflammatory bowel diseases like ulcerative colitis, and it is also seen in the cases of the SLE. It may be a part of the Beckett's disease, etc. The case scenario, let's see what you will get from this small discussion. That a 9-month-old girl, first of all, it is an infant girl, good general health condition. There is a progressive fever for 5 days, maximum is 39.5. It is associated with the coryza, running nose, exudative conjunctivitis, severe cough and irritability, no diarrhea, no vomiting, no recent travel, no pads, no past history of allergy. Rashes are over the tongue and abdomen, and it is turning into the black. Appeared 4 days after the onset of fever, not elevated and no itching. It is blanching and pressure. So these are type of rashes are seen. So it is a papular type of a rash, or it may be macular type of a rash, or maculopapular rash. In this girl, look, this girl of 9 months, definitely she has, look, the periauricular region and all this, and the hands also, complete maculopapular rash all over the body. Alarming situation for the parents. And this is a characteristic feature which was described in this girl as measles. Now, measles positive agent is a measles virus. and that is the double-stranded RNA virus. It is RNA virus. There are RNA viruses and the DNA viruses. So it is a paramyxovirus infection. Human is the host, invading, starting the portal of entry is the upper respiratory tract and regional lymph nodes. Transmitted by the large respiratory droplets with no fomites, close contact transmission. Droplets infection. Virus present in respiratory secretions, so infective to the others, and blood and urine. The period of communicability is contagious from 5 days before to 4 days after the appearance of rash. So before this rash, 5 days. After the rash, 5 days, means total of 9 to 10 days. The period of communicability may be present. The other children in the family can be affected. The endemic in the regions where the measles vaccination is not available. Measles vaccination is a part of the EPI in Pakistan. WHO launched this program by different names. And they introduced this vaccine at the age of 10 months because before 10 months there is a passive immunity in the child from the milk of the mother which contains the antibodies against this measles. After 10 months, because of the patient is now old enough to fight, so these antibodies disappearing from the blood and the protective action of these antibodies are gone 10 to 11 months of age. So the vaccination should be done in this period. If you are doing MMR, then you can do at the age of about 1 year, 3 months, or 1 year, 6 months, 1.5 years. Passive immunity may interfere with effective vaccination until 12 to 15 months of age. So try to vaccinate this child after the 1 year of age. It's better. 10 months afterwards. The clinical manifestation divided into 4 phases. First is the incubation period, is 8 to 12 days from exposure to the onset of the symptoms, 14 days from exposure to the onset of the rash. So the total here is about the disease will remain there about 15 days. The prodromal catarrhal period, there will be cough, there will be coryza, and the conjunctivitis, Stevenson line, that is, you've seen public spot specific, and it is on the secretory duct of the parotid gland around it, on the upper part of the palate. It is very near to the second or third molar, opposite in the buccal mucosa. Xanthematous rash, it is accompanied by the high-grade fever. It is about 101 to 103 degree Fahrenheit. The rash starts behind the ears first. This is important point. The pediatrician always asks where the rash started. Now it is behind the ears and on the forehead first, and then the hairline spread down to the leg, and in the descending fashion. Very characteristic distribution and propagation of the rash. It shows the severity of the illness. If this is like this, it means the disease is severe. So, and fourth stage is the recovery part. So the humoral immunity developed in the child and the disease will be gone. There will be conjunctivitis, Simpson line, public spots, you see. Here, you see. This is the upper part of the palate, you see these spots. Macular type of rashes behind the ears, and the beard area, and this scalp area, and then descending order. Morbilliform type of the macular rash. Other manifestations, cervical lymphadenitis may be there. You can palpate it, it's palpable. Tender lymph nodes, splenomegaly may be there. It is a, it is a viremia, and it causes the splenomegaly, abdominal pain associated with it. It may be mesenteric lymphadenopathy and can lead to otitis media. It can cause the pneumonia. In children, it is mostly the broncho type of pneumonia, and it causes diarrhea, which is called the parental diarrhea. It is common in the infants, but in adults, the liver is also involved. So there is disturbed liver functions, transiently. Biliary stasis, you can see. Mostly, but in some cases, it may be the actual hepatitis occurs. And there will be raise SGPT and SGOT. Investigation, you can do IgM antibody if it is recent, of course. Appear in 1 to 2 days of rash, starting it, and persist for 1 to 2 months. So this is ELISA you will do for the measles. Chest X-ray, interstitial infiltration, bilaterally. Negative measles pneumonia versus bacterial superinfection. There will be chances of the secondary infection in this child. The child may develop the bronchotype of pneumonia, or secondary pneumonias can occur. Another, it is the subacute, type of the, what is called as the myelopathy, and which occurs after 10 to 15 years after the measles. It is possible. So it is a demyelinating type of the myelopathy you see after 10 to 15 years of measles in some cases. And it will cause the weakness of the limbs of the child, and it misleads the diagnosis. The diagnosis can be done clinically with serology, with culture of the virus. PCR is now the gold standard methodology developed to diagnose very correctly, although we actually diagnose on clinical grounds. Complication, acute otitis media, interstitial pneumonia, already said, myocarditis, pericarditis, because of the viremia, involvement of the brain can occur as encephalitis, as meningitis, and subacute sclerosis, pancreatitis, SSP, that is called subacute sclerosis, panencephalitis, and myelopathy occur along with it. So it is a very, very remote type of complication associated with the mesenteric lymphadenitis. The pain occurs in the abdomen. Management is routine supportive care. You maintain adequate hydration, antipyretics. Some people are using ribavirin in severe infection. And they said that the high dose of vitamin A supplementation can prevent the severity of the infection. This is a study which has proved, and it's, in the 10 years before or 20 years before, it has been proved that the high dose of vitamin A, if you give along with the measles vaccination, it is very supportive to the measles vaccination as well. So the vitamin dose A supplementation is beneficial. Prevention with MMR, measles, mumps, rubella. Live attenuated measles vaccine. First dose is 12 to 15 months of the life, and second dose is 4 to 6 years old. Content indicated for severe immunosuppression because it is live attenuated measles. Rubella, German measles. Positive agent is rubella virus. Double stranded RNA, Toga virus family, host is human, and invading the respiratory epithelium. Portal of entry is upper respiratory tract. Transmitted by the susceptible contact infection in utero can occur congenital rubella syndrome during the first trimester of pregnancy. That is why it is important for the gynecologist to see it, whether the patient is suffering from this. So she will do what is called as rubella antibodies, IgG. If it is positive, then she should be very careful. In some cases, the abortion is indicated because it will cause the congenital malformations in some countries. Virus is present in the nasopharyngeal secretion and urine, and period of communicability is from 2 days before the contagious, before and until the 5 to 7 days after the onset of rash. After rash, 7 days. The total is about, again, 10 to 14 days. Epidemiology, the outbreak of the rubella in the non-vaccinated groups can occur in adults at their workplaces, prisons, colleges, and healthcare centers, and there will be transplantal antibody protection only during the first 6 months of their life in the children. Remember, if the rubella or measles or mumps, whatever you are calling these childhood infections occurring in adults, they are very, very severe. And complications are more in adults than in the infants. The clinical manifestation of the rubella is about 14 to 21 days, so before it 14 days, and then 10 days bliss. So it's been 24 days are the important period. Retroauricular post-cervical important nodes are the occipital lymph nodes. Posterior occipital, very, very uncommon place of involvement. Lymphadenopathy, occipital lymphadenopathy. Very few diseases can cause the occipital lymphadenopathy. One is rubella, leading to the erythematous maculopapular discrete type of rashes. And the distribution is not just like measles, that it is first of all it is behind the ear and then on the face and then the scalp. No. It begins on the one part of the face, spreads down to the body and last way. So the rash appears first of all around the cheeks, and that it involves the ear, and then it goes to the back. The chances of measles is less than rubella or more. A transient rash, 3 days. One of the non-specific type of finding which you see in any viremia, although it is very, very, commonly seen as Foch-Hemer's spots, rose-colored spot on the soft palate. Any virus can cause, but in this case, rubella, you will see these Foch-Hemer's spots very clearly. Mild pharyngitis, conjunctivitis, anorexia, headache, low-grade fever, polyarthritis, or reactive arthritis. Erythematous maculopapular discrete rash. Here the Foch-Hemer's spots, like this, on the palate. Very, very significant rash, this is, spots, although it is seen in other viral conditions also. Investigation non-specific and not aid in the diagnosis. WBC normal or low on thrombocytopenia is rare, and the serological test IgM antibody may be positive. ELISA, you can go for the ELISA, 4-fold rise in the specific IgG antibodies, the period, acute and convalescent area. Now this is what is called TORCH, TORCH. It is the screening test for the pregnant woman in the first trimester. TO for toxoplasmosis, R for rubella, C for cytomegalovirus, and H for herpes simplex virus. TORCH. The TORCH should be investigated. The serology should be done whether the pregnant lady has previously developed this type of infection or not. Otherwise, the congenital malformations may be more in these pregnant ladies. Complications are really complicated compared to the measles. What is called is the congenital rubella syndrome, and they are associated with the deafness and intrauterine retarded growths are there, categorically there, and the chances of the patent ductus arteriosus, the rubella. The congenital rubella, rash is there after the birth of the child. See in the face and other things. There will be congenital cataract. Principle of management is treatment is no specific surgery. Again, in the child, newborn, routine supportive care. Remember, try to take a careful eye on the respiratory tract because it can lead to the what I have already said, that is the bronchopneumonia, interstitial pneumonias. For the congenital rubella syndrome, baby should be isolated because the baby is infected to the others in the nursery, possibly that it will transmit the infection. The prevention is that MMR vaccination after the age of 12, which is indicated to 15 months. Before 15 months, it should be vaccinated. Measles, mumps, rubella. Children at the age of 46 years old, the booster can be done. The pregnant woman should be immunized after delivery. Just after delivery, they should be immunized. If she has the IgG antibodies against the rubella. Difference between the measles and rubella are very similar conditions. Rash, measles, yes. Rubella, yes. Fever, yes. Rubella, there may be fever or very mild fever or no fever. Characteristic is the confluent macular rash starting from the behind the ear, appearing on the face and the skin. There will be copric spots. Here the maculopapular discrete rash in the rubella, starting on the face and then on the other sides of the neck and the head, and the body will be involved, and the forged hemat spots, they are non-specific, although these are more specific. These are not specific, although it is very, very prominent forged hemat spots. Transmission is through droplet infection and airborne. It is droplet infection, not airborne, it is droplet rubella. Symptoms: high-grade fever, running nose, cough, and for 3 to 5 days followed by rash. Same. Rash with minimal to no fever or toxicity. Rash is important. Then the fever. Here fever is more than the rash. Infection possible without rash. It is possible. There will be a very transient type of a rash, you missed it, and the mother missed the rash. It is possibility. Spread of rash starts in the head and upper part of the body, spreads slowly down to the feet over 7 days in measles. But in the rubella, start on the head posteriorly and upper body, quickly down to the feet over 3 days. Complication: actually the same complication, but in the viral or the bacterial pneumonia, secondary pneumonia, or the primary pneumonia viral, encephalitis will be there, or may be meningitis, otitis media, blindness, may be possible with the measles. And congenital infection, it can cause the congenital rubella syndrome associated with the cataract and the patent ductus arteriosus. Severity is moderate to severe infection, measles. It can cause the mortality, high mortality in certain areas of the world. The rubella, although it is a mild infection in comparison with the measles. So these are some of the specific diseases which I have talked about and specific rashes which I have talked about. This is session 1, which I have taken because of discussion will be too prolonged for you. I will now conclude here, and I will continue with the session 2, fever with the rashes. Probably next video will be on this session 2. وما علينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.